Hi guys, so today we're going to talk about sexually transmitted infections or sexually transmitted diseases, or it could be also be known as venereal disease. That was kind of way back when. Alright, so we're going to look at the etiology and the clinical manifestations, diagnostic studies, health promotion, client teaching, and drug therapy for STIs. So when we look at STIs or STDs, I was taught STDs, but they could be STIs. They are very common. Nearly 20 million new infections occur in each year. 110 million people have STIs, one or more. Having one STI can increase your risk of getting another one. If you look at like patients who have syphilis, especially first stage, where there's a little chancre, that chancre can rupture, and now your patient has an open sore, and they can get HIV. You can have an STI without knowing it and thereby passing it on, or you can have more than one at a time. When we look at STIs, national perspective, these are 2018 numbers. I didn't pull them up, but you can see there's a lot of STIs. And three of the top 10 cities, this is 5, so the top 8 are Augusta, Georgia, Killeen, Texas, and Shreveport, Louisiana. And you say, well, gosh, those are kind of small towns. But when you look at it, they have one thing in common. They are home to large military bases. So when we look at the STIs, there's 3 different types. There's, first of all, let's talk, they are infectious diseases. They are spread through sexual contact with the penis, vagina, anus, and mouth, or sexual fluids of a infected person. Mucosal tissues in the genitals, urethra for men, vagina for women, rectum and mouth are susceptible to bacteria and viruses that cause it. When we look at, they cannot be transmitted from inanimate objects. Back when I was young, everybody said, "Oh my God, you can get a gonorrhea from a toilet seat." Well, we've learned that that's not true. When we look at bacterial infections, chlamydia, gonorrhea, and syphilis are all considered bacterial infections. Parasitic or protozoan are trichomonas. And viral are herpes, warts, HIV, AIDS, hepatitis B and C. All of those are considered viral. So what factors contribute to an increasing number of STIs? We see earlier reproductive maturity, increased longevity, sexual longevity. So we have a longer sexual lifespan. Other factors are greater sexual freedom, inconsistent or incorrect use of barrier methods during sexual activity, urbanization, and easier national and international travel. Certain groups of people are disproportionately affected by STIs. People under the age of 25 and those who are socially and economically disadvantaged. So the high-risk populations, men who have sex with men, and if you think about HIV, that's how it originally started. Adolescents, again, kids under adolescence, and then young adults. Men and women in correctional facilities, and victims of sexual assault. High-risk behaviors, not being vaccinated for the STIs that have vaccines. New sexual partners, more than one sexual partner. Sexual partners who've had multiple sexual partners. Sharing needles. And inconsistent or incorrect use of condoms. So let's look at some of the STIs. Chlamydia. It is the most common STI in the United States, estimated 3 million new cases a year. It's caused by Chlamydia trachomatis. It's gram-negative bacterium. Chlamydia is transmitted through exposure to sexual fluids during vaginal, anal, or oral sex. Ejaculation does not have to occur for this infection to be transmitted. The incubation period is 1 to 3 weeks. So, like I said, some people don't know they have a STI, and they're incubating it, and they can still transmit. With chlamydia, as like most of the STIs, having it once doesn't mean you're immune. You can have it multiple times, so you could be reinfected. The most vulnerable are women. The vagina is a natural reservoir for the infection. So, most common site in men is the urethra. Most common site in women is the cervix. The rectum, we can see rectal chlamydia, but it's really rare orally. With our patients, regular screening in high-risk populations. We have a high prevalence of asymptomatic infections, so regular screening. Anyone diagnosed and treated for chlamydia should be retested 3 months after treatment. Treatment is a single dose of azithromycin or doxycycline. Patients need to we need to treat the sexual partners, and the CDC recommends the expedited partner therapy. This is where patients, they can provide medications or prescriptions to the patient with an STI to give to the new partner, or to give to the partner without actually examining the partner. Chlamydia is usually tested by the nucleic amplification test. Patients should abstain from sexual activity 7 days after treatment, and until all partners within the last 60 days have been treated. Gonorrhea is the second most common. Most women who contract gonorrhea are asymptomatic or may have some small minor symptoms. For women, common symptoms are vaginal discharge, frequency, or bleeding after sex. Rectally, we can have painful bowel movements. Symptoms of oral gonorrhea are very few. Sometimes patients complain of a sore throat. Complications in men, we can see epididymitis. It can result in infertility. Men tend to be treated sooner than women. Women are asymptomatic, usually don't seek treatment, so they're going to be infecting others. Untreated gonorrhea can cause infection of the Bartholin glands and also can result in pelvic inflammatory disease. Pelvic inflammatory disease increases the risk for ectopic pregnancy, infertility. We know that with neonates, they can get ophthalmia neonatorium from the passage through the birth canal. And can result in permanent blindness. Almost all states require prophylactic treatment of newborns for gonorrhea. So with gonorrhea, typical care, there's a short incubation period and high rates of infectivity. Usually gonorrhea is treated before we get the results. The first line treatment is ceftriaxone IM with oral azithromycin. We have a lot of patients that have gonorrhea, that a lot of drug-resistant gonorrhea. So we want to treat it with 2 antibiotics. If the patient is tested or after their first treatment, if they're still infectious, then we're going to do a sensitivity. Typical treatment, typical care, patients, all sexual contacts need to be reported. All avoiding sex for 7 days after treatment. And I think that's it. Trichomonas. Trichomonas, the most common site in men or commonality is, again, one of the most common. Transmission is through sexual fluids. Incubation, this one is interesting because it's 5 to 27 days. Again, if you get it, you can be reinfected. The most vulnerable are women with HIV. The most common site in men, urethra, women, cervix. Uncommon to infect the rectum. Not known to infect oropharynx. Common manifestations, burning with urination, urethral discharge. Women, painful urination. So when someone comes into the ED and they're complaining of, it sounds like a UTI, we might need to check the patient for STDs. Complications, potential complications, inflammation or irritation of the genital tract if it's untreated, and makes a person more likely to acquire a secondary infection. Herpes. Herpes is a virus. It's an incurable, lifelong infection. There's 2 strains, herpes 1 and herpes 2. Both forms can cause genital infections. Herpes 1 is more common with oral lesions. Transmission is exposure to genital fluids. It occurs when an infected person is symptomatic. If they're asymptomatic, shedding can occur without symptoms. Incubation is 4 days, ranges 2 to 12. And the most vulnerable is higher in women than men, and those patients that are immunocompromised. When we look at herpes, primary infection occurs 2 days to 2 weeks. Patients don't realize that they have it. They're primarily asymptomatic. During the prodromal stage, the period before the lesions appear, the patient may have burning, itching, or tingling at the site of inoculation. And I think that's a good place to stop and pick up on the second videotape.